want to talk to you about this morning is when we think about healthcare and the digital journey that we're on, we see lots of information and lots of talk about AI solving problems inside healthcare. What I want to talk about is data, about safe, accurate, real-time and secure data. Within the environment, within the healthcare environment, we see a lot of consumer devices being used to collect and share data. We need to think about all the devices that we're using to collect and share data is that they're safe, that they do not interfere with medical equipment, they can be cleaned at patient bedside, so we're preventing that spread of disease and infection. It's also accurate that the data comes from multiple input formats, including medical devices and medical equipment. And we can use many forms of input, human readable, so capturing text, barcode, RFID, whatever that input is required from those various machines. It's also real time, so we update instantly. We've got to make decisions with that information almost immediately, so that the input must be almost immediate as well. And devices that are also always connected, the security is at the forefront of our mind. So bring your own device, is that the most practical application? It might be the most economic, but with security in mind is the most practical for the use. Does it have the latest Wi-Fi security? Is that determined by the IT department, or is that determined by the device that's chosen by the employee? So when we think about who, why, what, where, when, there's lots of data being collected. It's comprehensive data collection, which means if there's a breach, it's comprehensive loss. So thinking about real time and collecting that data immediately and sharing that immediately allows you to have that immediate response. So what resource is in which location, and how can we grab and share that information? So what is the asset that requires the input? What's the asset that's out of location or in an area of risk? And how do we communicate that across the hospital? Real-time information being shared. This allows us then to respond in an emergency. It also allows us to look at what's in the supply chain, what's really in the supply chain, and where that is, rather than what we think it is in the supply chain. So we can't really operate a real-time response unless we're gathering that real-time information. So last from me, I thought long and hard about what the lasting message should be that I want to get across, and it's more around security. And the links are at the bottom of the page where I get the data from. When we start to think about data breaches, and I'll let you look at the statistics, so I won't read those out. Most of data breaches come from devices that are lost or stolen. It's also those personal devices that we take and we place on Wi-Fi. So when we think about bring your own device, people bringing their devices into hospitals, we wouldn't allow police to do this or other emergency services, but we allow it in hospital to gather and share lots of vital information. We don't have control of the applications people load. We don't have the control of the unsecure Wi-Fi that people use, network spoofing, phishing attacks, which come by personal email and spyware. So my lasting message would be think long and hard about the types of devices that we use inside healthcare. It's lots of sensitive information, and that information is very comprehensive, and we don't want that out in public domain when it's breached. So that's my last slide. Think about devices, security, how we capture real-time information.